Welcome to the party. No gossip, just saying with Jodi and Jenn.
Hey, everybody. Welcome back to No Gossip, Just Saying. I'm Jenn, and today we are talking about something that literally came from a real conversation that Jodi and I just had yesterday.
It's true. And I'm Jodi, and sorry, I sound like Brenda Vaccaro from a 1980 tampon commercial right now with my sultry, smoky voice. But that is the allergies talking. Welcome to spring in North Carolina.
Woo woo.
So I'm going for the smoky voice. And yes, Jenn and I had a conversation yesterday that led us to today's topic. So I mentioned to Jenn that I had a doctor's appointment, and she was immediately like, "Oh my God, are you okay? What's wrong? Like, can I ask? Is it okay?"
Well, I did. In fact, I panicked. I was like, oh God, are you okay? What's going on? What's going on?
I know. And I was like, nothing's wrong. It's just my annual physical.
I couldn't even believe you said that because I take my children to annual physicals and I think I missed the last one. Oh my God, I'm going to mom jail right now. But seriously, okay, let's talk about this. You have a primary care physician, yes?
I sure do.
Okay, I don't. Isn't that terrible? But
I'm a rule follower. And I kind of grew up with that. Always go to the doctor, always go to the dentist. Now I grew up in Canada where healthcare is very different. But even moving to the US and having young kids, you get locked in by the school saying they must have their appointments, they must have their shots, they must.
yeah.
So you just do as you're told. And then I've just followed suit by the nature of how I was raised and what was expected. So I would find a family physician, and then the kids would go to their pediatrician, and I would go to my regular doctor, and we would do this annual checkup. And it was just kind of a routine. It's a routine that I've gotten into throughout my life.
Yeah. Okay. But I'm going to push back on this because I always suffered from sinus infections. In fact, I had sinus surgery 2 years ago, and now it's like free sailing, free snorting, and free breathing. So I am a happy camper. But before then, I would always find myself needing, and I hate taking antibiotics, but I would need one just to get rid of a secondary sinus infection, right? And then you can't get into your primary care doctor, and they're like, "Oh yeah, we can see you in 21 days." I'm like, "Oh, screw that!" And then I end up urgent care. So I guess the urgent care doctor is my primary care doctor, right? That's bad, right? But that's the reality.
That is not uncommon. That's not uncommon here in the US of A. And I mean, we could go down that whole rabbit hole, but we won't.
Well, and now Teladoc makes it even easier, right?
I love Teladoc.
I mean, if you need meds, Teladoc, go to the meds. And you're like, okay, bye, see you later.
It's valid and it's real. And my son has used that. When you have something that's easy to diagnose, like pink eye or throat infection or, eczema.
Yeah, something that okay, I've had this before,
easy.
Sinus infection. It's a pretty easy hitter,
and
right?
They can see your file and they can see that you've definitely had a history of this. They will write the prescription for you. Obviously, if it's more major than that, they're going to expect you to go to physically see a physician at some point and make an appointment. But they can pretty much triage you on Teladoc now and send you on your way with your prescription, which is nice.
That's true. But this appointment was not that. And so I'm interested to hear your whole take on how, why, what, when, who, because I need to change my whole thought process if I'm going to follow you down into this rabbit hole, because I go to the doctors when I don't feel well, I'm sick, or I can't shake something and it just won't go away.
Yeah, and I think that's normal. That's really normal behavior, and it's really easy to do. Healthcare costs are really high. People don't want to spend the money to go to a doctor's appointment. Now, my annual physical, based on the insurance that I currently have, covers that trip to the doctor's office. Now, if I dare ask a question about something outside of the annual physical, I get slapped with a little $20 charge.
Ooh, it's like the nail salon.
Yes.
Remember the nail salon? They're like, "Oh, do you want the spa pedicure?
Yeah. So
do you want the spa pedicure, or do you want the one with the hot rocks?
Yeah. Do you want the classic or do you want the upgrade?
Ooh, do you want the neck massage too?
Right.
Oh, do you want the sparkle glitter?
That's what the doctor's appointments have become, though.
They're nail people.
So,
Ew.
No, they're not nail
I'm
people.
just kidding.
I'm
teasing.
No.
Listen, we have plenty of MD friends, and they're badasses.
Absolutely
so,
not.
No.
But that does happen, and they're stuck in this circle as well. Listen, that it's not their business.
No,
It
they
is
don't.
what it is.
They don't want to go chase around $20 extra, like to go put
Ex-
another ICD-10 code in just so they can charge more for it. Like that sucks. I totally agree.
Exactly. But anyways, so I go personally to this annual physical. It's covered by the doctor, but what it does do is I get blood work drawn.
Okay.
She listens to my heart. She listens to my lungs. She asks me questions about my history, if anything's changed. Oh, my favorite question, though, I will admit now that I'm over a certain age, is, have you fallen recently?
Have you fallen and couldn't get up?
And I'm like, no, or maybe in a dance insanity class once. But anyways,
What is
no,
that?
have you fallen? Oh, no, but the best part is the next question is, do you have a fear of falling? Well, don't you?
I do.
Don't you?
I do. I don't want to fall down.
Okay, we can
Like,
fix the question.
Like we're 5'10". Like that's a long way down. Like Jesus. Right. I don't need shit to break in half. Like yeah. And I'd be like, lady, you're scared to fall too.
Even if you're 5'2", you're afraid to fall.
Yes.
Nobody likes to fall.
No.
Yes. Jessie is raising her hand. I am not going to fall. I don't want to fall. So anyhow, yeah, you get to a certain age, the questions get a little bit sketchy. But anyhow, it's a maintenance thing. My personal belief is I kind of compare it to like car maintenance, right? So every day, you know that you get in your car and you start your car and you're counting on it to have air in its tires, gas in its, tank, and it's ready to go. So I maintain it regularly by putting gas in it, by making sure the car, the tires have air in it and all the basic needs. But I also make sure that I take it in every 10,000 miles for its, oil change and all the regular maintenance. And there's like a little thing that comes up on the dashboard, quite frankly, and says, excuse me, you need to take me in for maintenance in about, I don't know.
It's the little orange blinking light with the exclamation
Well, it's
point.
not blinking yet. No, that's not when you're supposed to take
Oh, sorry. Oh, see. Okay.
There you go.
Okay. I'm back at urgent care again. Sorry about that. I'm back in urgent care swimming around this cesspool of germs.
Oh my God, if that didn't just define the difference between you.
Yep, that just summed up Jodi and Jenn right in a nutshell. I'm like, oh, is your blinking orange light with the exclamation on it? Figuratively and literally.
Oh my God. So there you go. There's the difference between the rule following, gonna do all my appointments, gonna do all my maintenance, and then we got the let's just deal with it as it comes up, girl.
Yeah, that's me. Okay, but hold on. Okay, so let me interject.
I am holding on.
You better hold on to your hats and glasses.
On horse.
Okay, so here's how my little trajectory has gone. So I am not in the people making business anymore. Have had the tubes tied, but when I was at the damn OB-GYN like all the flipping time, right? So I sort of made them my
Did
doctor.
they give you lollipops?
No, they didn't give me lollipops, but they they check the girl business, all the girls
get checked,
and they check all that. But I felt like I was there a lot more than the regular doctor.
Yep.
And then we moved a bazillion times, so that stinks, and we'll get to that in a second too.
For sure.
But then I went on this thing called HRT. Hormone replacement therapy. Dun 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 dun. That's how I feel about it.
Riding the pony.
For me, I'm riding the pony. But I go to a DO, and she has me do a blood panel like every couple months, right? And so I get everything, like every single panel that I'm looking for and for screening. But then should I be asking her listen to my lungs, listen to my whatever? Because I feel like it's very specialized, which is good.
It is. Yeah.
Right. So I feel like I jump to the specialists when I need them. I mean, I might as well have a freaking frequent flyer punch card at the damn ortho place. Jesus. Yeah. If it's not me, it's my kids now. Oh, by the way, do you realize that orthopedists now, they have urgent care orthopedists? How smart is that?
Well, that makes sense.
Right? But that's a new concept.
Well, I'll tell you, it's funny because it's so different I guess I spent my first 40 years in Canada. And so healthcare is really, really different. Listen, it's all circled around the general practitioner. The general practitioner, your family physician, is the one who gives you the referrals to the experts in their fields, their particular fields. Like you don't.
Because that's how it used to be here.
Well, did it? Did
Yeah.
it? Because
Yeah.
when I moved here, it felt like it was automatic that your kid got a pediatrician. In Canada, they don't. Maybe it's different now. I haven't lived there in 20 years, but maybe it's new there that they do that. But it was always the kids, the family all went to the same doctor. The pediatrician was if there was a healthcare issue with the baby, the child, whatever.
And now it's pediatrician first and OB-GYN first for women. Isn't that interesting?
It's funny. To get an OB, you had to be pregnant. Like you, and I will tell you, I think I was 30 weeks pregnant before I got sent over to the OB. Yes. The primary care physician.
What did you grow up on Little House on the
Canada.
Prairie? Like what?
Pretty much.
Wait.
But it was fine. The
Wait, I'm
healthcare
sorry.
was fine.
Rewind. You did not go to the OB-GYN until you were 30 weeks.
For my first one.
Holy
Yeah.
shit. Are you kidding me?
I had a perfectly normal, healthy pregnancy, and my doctor was capable of.
Were you one of those like
weighing me in
annoyingly
and-
like super young 20s like pregnant girls who like
No, I
has a
was
little
in my-
basketball and then they just like slip out and then you're like, here you go,
was-
here's a baby.
No, I was in my 30s.
I was not
when
one
I
of
had
those people.
kids.
Damn, Jodi.
Yeah.
So damn.
No,
we,
that
have a
was
song. We have a
just-
song, by the way, Danz saying, damn girl. Damn, Jodi. Okay, so you didn't know the sex of the baby.
I didn't want to.
Oh, you're so
Well, I did my
traditional.
No, understand. I did my ultrasound at
Okay.
12 weeks or whatever.
But where did you do the ultrasound? At the primary care doctor?
Well, no, you went to an ultrasound. You at the hospital. They send you to
This
the
is
hospital.
so fascinating.
It's just different.
Okay,
It's different.
it's different. You had a primary care who's sort of like your quarterback, right? Where here, and I think it's just as common that people don't. They go right to a specialist.
Yes.
I do think though there is some merit to be said, whether it is a primary care doctor or a DO like my HRT doctor. You need somebody
Yes.
that you're checking in with, and I think that's where the line of demarcation kind of starts and stops. Because when you need doctors, like when you're in childbearing years, right? Let's face it, even Jessie in her 20s, who's sitting here looking at me like I'm nuts, but she always does because I'm always nuts. But even I was so proud of her. She made sure to go get her teeth cleaning. Even if medical self-care starts with a dental appointment that you know you're overdue to do, self-care is medical, not just physical, being at the studio, eating good foods, doing the right thing nutritionally. And if it starts with a primary care doctor for you, great. If it doesn't and you have a DO, let's say, maybe you're seeing somebody for HRT, because we talk a lot about that. We have, our average age at the studio is 46. So that's not uncommon to hear. Or if, let's say, you have somebody else that you're seeing as a specialist. I think that in the US now, we are steering more away from primary care to be that main person you see. But if you still do, go see them. Right? I think that's the message, right?
I think
Go
the
see
most
them.
important thing is to get, it's good to have a baseline.
Yes.
So, and once a year is probably a good amount of time to have a baseline that's a recheck. So you do blood work, right? When you go to this doctor, whoever it might be for you.
Physical
they
exam.
check, they listen to your heart, they listen to your lungs, they look into your eyes, they look into your nose, they look into your throat. They check you and give you just a quick glance at what your general health scope is.
Yes.
And then, yes, I believe they act as a nice triage to sending you may not be connected to, an OB, you may not be connected. So they're intended to be good connectors to specialists, right? But a lot of us, I find via word of mouth, end up finding specialists also, because you don't usually have to use a referral based on most insurance here. Whereas I know where I came from in Canada, you had to have a referral written. Like you couldn't just go to somebody who was a specialist. That was very different. And it's actually really nice because it's easier to get access, because sometimes there's waits to get in to see these specialists, right?
Yeah.
So the sooner you can. But your general physician can then just give you a baseline. Even an EKG, they can do baseline EKGs for you. And then you have the opportunity to potentially catch something that's starting to brew. Okay.
Yes.
This is also the person that's going to hold you accountable to going for your colonoscopy.
Yes.
They may be the one that says, hey, it's time, or keep you up to date on have you gone for your mammogram? They'll push you to go get it. If you aren't seeing someone annually who's telling you to do that, what might you not do?
You won't go and do it.
Exactly.
And for everybody listening out there too, remember, especially the mammogram piece it's such a hot topic. You do not have to have health insurance
No.
to go and get screened and
No.
get tested. And that's an important thing. I think that the new law, or the new suggestion was every 3 years, but you can go every year. And,
I do.
to also connect with people that they're like, hey, you know what? I'm in between jobs. I have to do my own healthcare. I'm not afforded healthcare through my
Right.
company or wherever it is, right? There's all different kinds of health fairs all over the place
You can find free
you
shit.
can find free shit. You can.
Even for cardiac help. Like,
cardiac screenings, all of that stuff. You can, absolutely.
yeah.
I would also say too, it's not just going to the primary care or the OB-GYN for a check, but it is to the dentist.
Yeah.
It is to the dermatologist. Like I'm getting a skin check next, oh God, not until June, which I was like, oh God, I can't enough. But I mean,
For some reason, I always go in the summer too, and I get scolded for the little tan. I'm like,
yeah,
summer,
but
sorry.
but I think the one thing that, and if I can get some snaps after I say this, like please do. I think the one thing that we all get a little bit fearful of is, okay, now that they're there, do I want to know? Oh God, I'm freaked out. Like I think that I have
Yes.
every single thing wrong with me before I walk in. Like, why do I do that? Does anybody else do that?
Yes, and I think the mammogram's the biggest, scariest one out there.
Yeah,
right
when
now,
they flatten your
Tara.
boob like a pancake and it hurts. What is that all about, by the way?
But it's but it's fine. You're gonna be fine.
Do you
It
know?
hurts for
yeah.
like a second. I mean, pinch your ass, and that's how it feels. Like you're fine.
Do you
Just
know?
Suck it up.
Do you
It's
know?
fine.
Last year, I got the call that they were like, "Oh, we need to test you again."
That's what people freak out about.
Are you ready for this? So I go in. They flatten my boob like a pancake again. And then this is actually very cool. The radiologist, they're like, okay, go in this room. And I was like, what? And so now I have no idea what's going to happen. And the radiologist walks in and she's like, okay, so first of all, you're totally fine. I'm like, oh my God, sweet Jesus, thank you. I can breathe right now. But she's like, no, we weren't going to make you wait. But she's like, no, I think they just didn't have the right sort of angle with your breast tissue. I'm like, are you serious? I've been sweating for 3 weeks. But I mean, that's just the nature of the beast, right?
Yep.
Like the minute you're like, oh God, this could be me. So I think the number one thing is rip off the Band-Aid. Right. I mean, just go and do it because
Hey, if they see something, they're going to help you fix it.
and if something is wrong, wouldn't you like to be ahead of it
Be ahead of it.
than after it? Yeah. I would say that, as much as it sounds like the old lady thing or the old man thing to do a colonoscopy, those are big. And I know it's gross because you have to drink Gatorade. And I look like I was 9 months pregnant and more like 19 months pregnant because my stomach distended. I was so bloated. But I'm so glad that I knew that I got a beautiful, clean colon and I was told all about it. But, at the same time, I got a nice nap out of it. I was asleep for 45 minutes. I felt refreshed.
There's something about that nap.
And yeah, right?
I know.
Is that sick and weird that I kind of like being put out
Twilight
sometimes?
nap. Oh,
I
it's a
know.
beautiful thing.
I know. But I also knew that
And-
I had no polyps. I had no yucky grapes in
I
there.
had a good one too. I had a nice, good.
Yours was pretty and clean and
I had a
sparkly
good
too.
Sparkly colonoscopy too. But yeah, I have to do one again in another year. It'll be 10 years since I've had it. I was lucky to get that diagnosis as good, and I'm not afraid to do it again. It's the prep takes obviously a day out of your life.
Yes.
And then you eat like an animal when you get out of there. My daughter was my
Cheeseburger.
responsible adult after my colonoscopy because my husband was traveling. And I was like, we're going to have to stop here. And we'd stop. And I think I still had the Band-Aid from my IV on my hand. And I just going in, almost in a hospital gown, going, just give me all the food. And then we went to the next place. I ooh, but the chicken from here is really good. We should stop here. And she was so sweet. She drove through 3 different drive-thrus for me to get food upon food beside food on top of food.
You mean you weren't excited about the Jell-O and the Gatorade for the last 2 days anymore?
I was so over
It's
it.
gross. It's so gross. But
Yeah.
you know what, though? It's good for you. And I will
Anyways.
say, even from more lighter medical approach.
Yep.
So I talked about a few weeks back that I had back spasms, right? And I go to get dry needled. I hate them, but at the same time, they're so necessary. And you love them.
I love them in a sick,
you love the torture
way.
But you know though, I do think sometimes like some people take a running, like darting leap into where I need to get needled. And I'm like, Jesus. See, Jessie knows because she goes the same place I do.
Oh, I think
she
my
does.
guy's nicer. You should go see my guy.
But I went to a different guy within the same practice.
And
you can't compare, one injury from the other. Who knows? Yeah. I mean, there's so many variables. And they are all good.
Yeah.
But because it finally released, okay, here's another really good medical self-care. Even though my back is better, I now have scheduled a once a week needling appointment prophylactically. Yep. Like I cannot be out. I can't be injured. And I was like, you know what? This is a small price to pay for my body. That's basically my work instrument to do my job.
Well,
right?
Exactly. It's like I will drop down thousands of dollars to make sure my car is in working order so that I don't have to deal with the big bright red engine light like somebody else in the room.
Mine's orange. Thank you very much.
And then like yours is orange.
Orange with an exclamation point.
I guess when it's red, it's really bad.
Yeah.
Part of my personal maintenance package is that I will go for monthly massages. And sometimes they are just relaxation massages for stress maintenance. And sometimes they are stick your elbow through my back into the front of my body to fix knots and broken things.
Ooh, I like those ones.
Yeah,
I like those ones.
Those are good.
So there's these clinical med spas that are popping up all over the place, and they are a restorative recovery kind of strategy for people to go in, and whether they're offering cryotherapy, red light,
I've seen that.
red light rooms, salt. I think I might need to go experiment in one of these places and write it off.
Let's go sample. Let's go
sample. Should we sample?
There is one coming to Raleigh, I think, soon.
There's one in Wakefield.
Is it already open?
Yes.
Because there's, the red light therapy sauna room.
Yes.
And then they've got the cold plunge room.
Yep. Then they have a salt sauna too. That's crazy.
Oh, dang.
I know. I'm not really sure exactly. I need to do more research
might have to
on
go
that.
On the maintenance schedule.
Maybe on a maintenance schedule. And they have a laser. Yeah. So like if you have any.
Other people love to go to chiropractors for maintenance.
Yes. Yes, they do.
It's not something that I've done, but it's definitely.
I think that is a total
personal choice.
Yeah, personal choice. But I know some people that are like weirded out by other people touching their backs or their bodies for massage. They're like, creepy. No. I think the last point that I would say about self-care in a clinical manner, whether you're going to one of these newer kind of pop-up self-care, cash pay, red light therapy, cryo, yada, yada, yada. Or you're saying, hey, I need to go to my primary care, or I need to go to my HRT person or my gyno or whatever it is. I think that more often than not right now, primary care physicians, OB-GYNs, they're becoming part of big practices. This is a thing.
Yeah.
And the more you can establish a relationship with one of them that really follows you from one session, one appointment to another. So there's a history. Because chart notes are only as good as what you write in them. And usually it's diagnosis, prognosis, medications. And it's not all of the things that people just kind of yammer on about. And there is importance to that. There is importance of establishing a relationship with whatever kind of healthcare provider you're going to see, because that requires and builds a trust that you now maybe aren't as afraid to go make that appointment for a well check, because you're like, well, I like that guy or I like that girl. Okay, they're not scary anymore, right? The unknown is gone.
Just like in your journey to becoming more fit and more nutritious, sometimes you need that person, that leadership behind you, giving you that push. So if you establish a doctor-patient relationship, no matter what that looks like for you, it's that person that tries to hold you accountable for doing the right thing for your body, because ultimately what you want to do is live longer, better.
Yes.
You want to live longer, better. That means you want to be healthy and happy at 85 also, because our life expectancy is long, you guys. When you were born, your body was designed to live to say 100 years.
Yep.
Like you have to treat your body as if you're going to live till you're 100 years old. And then that way you're not, unfortunately in a nursing home, or you're not in a really bad place where you need 100% care at the age of 70 or 75. You want to live better. So you take the first step with fitness and nutrition. And then you have the support of people who are professionals behind you.
Well, and shameless plug too for Danz, but Tramp as well, is that when you are remembering and having to recall choreography and steps and everything, it becomes so much more than just exercise. And there's been so many studies proven about this that so you're not that Alzheimer's patient or dementia patient, or you have to be in memory care, whatever it is, as like a little old lady, a little old man, what we're doing right now really affects your cognitive versus just your physical. So if you're already doing all of these things, especially with us, take the next step and round out your self-care, right? And don't be afraid of doctors. Like they're there to help you. They're there to help you. I mean, I only play one on TV. I'm not one, but at the same time, the more I establish,
you look so good in your white coat.
Thank you. Thank you with my stethoscope. Yeah. But in all honesty, it's true, because what are you scared of? Like what? Oh, finding out maybe something you don't want to find out. Well, wouldn't you rather finding out now if there's something wrong and being able to fix it and being in the right hands before anything gets worse, right? That's always the key to it.
Absolutely.
And I'm talking cavities as well. Like I'm talking dentists, right?
Mouth
Dentists
pain
are the same thing,
Oh, so many people are afraid of the dentist. I love
Listen, I'm afraid of my back going out, so I get needles put in my freaking back. Okay. So that's my scare right now. Like I'm like my hands are already starting to get clammy because I'm thinking about the needles that are going to go in my back later on today. I'm like, oh shit. Here we go. Come on, Tyler. Let's go.
There you go.
Take a darting lunge into my freaking back in my TFL. Yeah. What?
And this has become preventative care now. Look at you doing preventative
Look
care.
at my engine light's not on and blinking.
It was, and then we fixed it, and now you're maintaining.
Well, I think we've hammered everybody home on this subject matter, don't you?
I hope so.
I know.
Prevention is key.
All right. Well, I think that's a wrap on this episode of No Gossip, Just Saying. Thanks for hanging out with us.
Make sure to hit follow and subscribe. And if you love today's episode, leave a comment on YouTube or drop us a 5-star review on whatever platform you're listening on.
And until next time, no gossip.
Just saying.